Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Hey everyone, welcome back for another deep dive with us. Today we're diving into a topic that we have gotten a ton of requests for, and that is the differences between osteoarthritis and rheumatoid arthritis. We're going to be looking at some really interesting stuff from Alberta Rheumatology. They really know their stuff when it comes to joints and inflammation. So by the end of this deep dive, you are going to be able to tell these two conditions apart, no problem. And you're going to know what causes them and why that even matters for treatment.
Yeah, it's a really common misconception that arthritis is just one thing, like, oh, I've got arthritis. But it's actually a whole bunch of different joint conditions lumped together under one umbrella term. So to make it a bit easier, we can think about there being two main types, degenerative and inflammatory. Osteoarthritis, that's the most common one that's degenerative. And then on the inflammatory side, the most prevalent one we see is rheumatoid arthritis.
Okay, so two distinct categories, both affecting the joints, got it. But how common are these conditions? Like, should we be worried? Should I be worried?
That's a great question. And the answer, like with most things in medicine, is it depends. So if we look at how widespread these conditions are, osteoarthritis is way more common. It affects about 10% of people, whereas rheumatoid arthritis is less common. It only affects about 1%.
10%, that's still a lot of people. So no wonder we had so many people writing in to ask about this topic. Okay, so we have these two types of arthritis, each with their own thing, but are there any external signs or symptoms that we can look for to tell them apart besides what's actually happening inside the body?
Yeah, definitely one of the biggest differences is actually which joints are being affected. So with osteoarthritis, there's usually a pattern. It typically affects the hips, the knees, the base of the thumbs, the big toes, and those end joints of the fingers. And people might notice pain in those areas. Sometimes you can even get these bony enlargements.
Okay, so it's pretty consistent in terms of where it decides to show up. What about rheumatoid arthritis? Does it have like a favorite spot?
Rheumatoid arthritis is a little more unpredictable. You usually see it in the proximal joints. So those are the ones that are closer to the center of your body. Places like the wrists, the hands, and the toes, but it can actually affect pretty much any joint.
So it sounds like even though both conditions can cause pain and swelling, where that pain and swelling shows up can actually give us some clues. So if I'm noticing it more in my wrists or my knuckles, that might point towards rheumatoid arthritis, not necessarily diagnosing it right there, but it's definitely a piece of the puzzle.
Exactly, and that's why getting a good medical history and having that physical examination is so important.
That's super interesting. So the location of the pain is really important, but I'm also wondering, does the timing of the pain matter? Like when it flares up or what makes it feel better or worse?
Yeah, it's a really good point. The timing of the pain can tell us a lot too.
Sure.
So osteoarthritis, it often gets worse with activity and then feels better with rest. It kind of lines up with that classic wear and tear association, although it's usually a bit more complicated than just that. Rheumatoid arthritis, on the other hand, tends to feel better when you're moving and worse with rest, which seems a little backwards, I know.
Yeah, it does seem a little backwards. So just to make sure I'm following you correctly here, if I move a joint with osteoarthritis, it might make the pain worse. But if I move a joint with rheumatoid arthritis, it might actually ease the pain.
Exactly. And that difference in how the pain responds to activity can be the key to figuring out what's going on. And then, of course, what the best treatment's going to be.
That makes a lot of sense. Now, you mentioned wear and tear with osteoarthritis, which is something that I think a lot of people just associate with getting older. Is that true? Is it really just our joints wearing down over time?
Well, age is definitely a factor with osteoarthritis, but it's not quite as simple as our joints just wearing out like an old pair of shoes.
I had a feeling there was more to it than that.
There is a lot more to it. There are actually several factors that can contribute to osteoarthritis, things like genetics, your weight, previous injuries to a joint, even your occupation. It's really this whole collection of things working together. Rheumatoid arthritis, on the other hand, that's classified as an autoimmune disease.
Autoimmune meaning that the body is essentially attacking itself, right?
Got it. So with rheumatoid arthritis, the immune system, which is usually protecting us from all the bad stuff out there, it starts to mistakenly see the lining of the joints as a threat, and it attacks it. That causes inflammation pain, and then over time, it can actually damage the joint.
Wow. Okay, so with osteoarthritis, it's more about the mechanics of the joint itself and all of these different factors that are playing a role. But with rheumatoid arthritis, we're talking about the immune system turning against us. That's a pretty big difference.
It is a big difference, and that difference is really important when we start to think about treatment. But before we get into all that, there's another really key difference that we need to highlight. We talked about how osteoarthritis usually affects certain joints, right? Well, it also tends to stay put in those joints. The damage is usually limited to just those specific spots. Rheumatoid arthritis is different. It takes more of a systemic approach.
Systemic meaning, what does that mean? Does it spread like an infection or something?
Not spread exactly, but it can affect the whole body, not just the joints. We're talking the heart, the lungs, the blood, even the skin and eyes, because it has the potential to affect so many different parts of the body. That's why diagnosing and treating rheumatoid arthritis early is so important. It's not just about managing the pain in the joints. It's also about trying to prevent these other problems that might pop up.
That's incredible. It sounds like early intervention is key with rheumatoid arthritis. But we were talking earlier about things like genetics and smoking. Do those factors play a role in both types of arthritis, or is it just one or the other?
They can actually influence both, although we're still trying to figure out exactly how that all works. But there's more and more evidence that suggests certain genes might make you more likely to develop either osteoarthritis or rheumatoid arthritis. And smoking, we know for sure, that increases the risk for both conditions.
Okay, so that's another one to add to the list of reasons why smoking is a no-go. All right, let's switch gears a bit and talk about treatment. We've covered a lot of ground here about how these two types of arthritis are different, but how do those differences actually translate into how doctors approach treating each one?
So with osteoarthritis, the main focus is on managing those symptoms and helping people maintain as much function as possible in their day-to-day life.
So it's all about keeping people moving and living their lives to the fullest, even with the pain.
Exactly. Yeah. It often involves a bunch of different things working together, things like physical therapy, to help strengthen those muscles around the joints. We're talking pain management, so medication, things like hot and cold therapy, losing weight, if that's appropriate, to try and take some of the stress off of the joints, using assistive devices for mobility, and then in some cases, if other options haven't worked, we might talk about joint replacement surgery.
That makes a lot of sense, finding what works for each person. But what about rheumatoid arthritis? If the immune system is the one causing all the problems, can we even treat it the same way?
It's definitely a different ballgame with rheumatoid arthritis. The goal with rheumatoid arthritis is actually remission.
Remission, so we're not just trying to manage the symptoms, we're actually trying to stop the disease in its tracks.
You got it. And the main way that we do that is with medications called DRARDs, which stands for disease-modifying anti-rheumatic drugs.
DRARDs sounds intense.
They can be powerful drugs, but they're also incredibly effective. They basically work by suppressing the immune system's attack on those joints. And that helps to slow down or even stop the progression of the disease. And ultimately, the goal is to prevent more damage from happening and keep those joints working as well as possible.
That's amazing. So we can actually tell the immune system to stand down and it listens. That's wild.
It really is amazing how far medical science has come. But it's not all about medication. Treatment for rheumatoid arthritis usually involves a combination of medication, physical therapy, occupational therapy, and lifestyle changes to manage symptoms and improve quality of life.
It sounds like a really holistic approach, looking at the whole picture.
Exactly, and finding the right combination is really a team effort between the patient and their healthcare team.
So to recap, with rheumatoid arthritis, we're trying to change the course of the disease itself. And with osteoarthritis, the focus is more about managing how it affects everyday life and keeping people moving.
That's a great way to sum it up. It's about tailoring the approach to the specific type of arthritis. But even though the goals are different, both conditions share something in common, and that's the importance of relieving symptoms and making sure that you can live your life to the fullest.
That's a really important reminder that no matter what type of arthritis you have, there's always hope for a better quality of life.
Absolutely. With the right diagnosis, a treatment plan that's tailored to you, and ongoing support, it's definitely possible to lead a full and meaningful life, even with arthritis.
This has been such an insightful deep dive. We learned that osteoarthritis and rheumatoid arthritis are two separate conditions, each with their own causes, symptoms, and treatments. We busted the myth that osteoarthritis is just wear and tear, and we talked about how the immune system is actually the culprit in rheumatoid arthritis.
And we talked about how important it is to pay attention to those little details. Things like which joints are bothering you, how activity and rest affect those joints, even how long that morning stiffness sticks around. All those little things can really help us figure out what's going on and how to treat it.
It's amazing what we can learn just by listening to our bodies and paying attention to those patterns. But before we wrap up this deep dive, I want to leave you with one final thought. We learned today that rheumatoid arthritis is an autoimmune disease, which is where the body's defense system gets a little confused. It makes you think about all the other ways that our immune system plays a role in our health, not just in our joints. Maybe this deep dive has made you curious about other autoimmune conditions, or maybe you're interested in learning more about the immune system. No matter what you decide to deep dive into next, keep asking those questions, keep learning, and keep exploring the amazing world of science and medicine. Thanks for joining us.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifan, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.